Perfect. Good morning, everyone. Thanks for joining us. Happy Collaborative Month. This is the Direct Care Workforce Collaborative September meeting. We're happy to have you here. We know lots of folks will be continuing to join us, and so we'll just keep checking in with everybody. But yeah, happy to have you here, have a full agenda, lots of good information for you today. And so yeah, we'll jump right in. Just giving a quick overview of the agenda, we're going to do some attendance, some polls, just some housekeeping stuff that we typically do. I'm going to talk a little bit about the base wage team or the workforce unit team that covers the base wage. And then I'm going to kick it over to Jennifer Watkins to talk to you about the wage compliance review process. And then Carrie Chesney is here for base wage resources for workers. So we're really doing kind of a three-part what does base wage look like here in the state and who you'll be working with through each stage. And so we're excited to kind of break that down for you and share that information. Then we have a pre-record from Dr. Kelly Page on a pilot program we're working on with learning and employment records and some badging that we're doing in a digital wallet, which we're excited to share an opportunity for you all. And then we'll have time for an open forum, and then we'll close out with some surveys, resources, and then the closing as well. So a packed agenda today, but we're looking forward to it. So we are recording, and that's just your reminder to avoid sharing any protected health information. We do share this out with folks that weren't able to join us at 10 o'clock on a Wednesday morning in real time. So we make sure that people can access this on our website. So that's just a reminder to be careful of what you're sharing, be mindful if it's not something you want to put out to the masses. You're welcome to use the chat. We have several folks here from HCPUF helping me manage the chat today. Any questions in the chat I will call out so they're captured on the recording. We will post the slides, including all of our presenters with the live links will be posted to our website probably next week, along with the recording. That way you can access them. And then we typically do also have a document where we capture all the links that were shared in chat, both from the department and also from folks with some good resources that we'll send out to you as well. So you're not trying to save all these links during today's meeting. If you're listening by phone, welcome. Thanks for joining us. You are always welcome to press *6 to unmute your line or *9 to raise your hand to contribute to today's conversation. We would love to hear from you. I have turned on closed captioning, and you are able to control that on your own Zoom toolbar with I think it's the CC. You can turn that on or off for the live transcript icon at the bottom of your screen. And meeting information for today's meeting, as well as other opportunities to get involved with the Direct Care Workforce Collaborative, can be found on our website, which I will copy and paste in the chat right now. You'll also see another website in there, and it is our Direct Care Workforce page. So that's all the work that's happening in this space that is tied to our team. So you'll see information about base wage, rural sustainability, and also direct care careers, everything just kind of on a landing page for you there. If we wouldn't mind doing just a quick little roll call in the chat, we'll do some attendance. So if you wouldn't mind putting your name, your location, and your role or title, just how you're connected to today's work. And if you're a phone-only user, just go ahead and press *6 to unmute your line or *9 to raise your hand if you'd like to participate and be captured in today's attendance. But I'll give folks some time to do that as we kind of move through these first couple slides here. We do have an opportunity to be added to communications list. And so if you're interested in signing up for our email newsletter, that is for the entire Office of Community Living and not just for our office, though we are included in that. That's the OCL newsletter, used to be the John Barry newsletter that would come out once a week. But we'll have updates about these meetings as well as other opportunities in the Office Community Living in that. And so you're welcome to sign up for that to keep tabs on all things Office of Community Living. If this is your first meeting, we just like to level set for you a little bit and give you a nice welcome. The purpose of the Direct Care Workforce Collaborative is to advance public awareness of the direct care workforce and advocate for improved compensation, benefits, training, and career advancement. We envision a strong, skilled, and respected workforce that delivers high-quality care and support, enjoys meaningful career opportunities, and continuously renews and is continually renewed and strengthened by the attraction and retention of new entrants across the healthcare sector. So just that little thing we're trying to work on here. But we really want to really elevate this workforce, share resources that are connected to it, and just allow folks that have an interest in this space to come together and learn. So the Direct Care Workforce Collaborative is made up of this quarterly meeting, and then we also have 3 action groups that come together bi-monthly. We are kicking those back off. We took the summer off, but we're kicking those back off this month, and that is training and career advancement, compensation and benefits, and value and awareness. And we love to hear from our stakeholders in those meetings, and so stakeholder voice is paramount. And to that point, we have co-chairs, stakeholder co-chairs that come together for these meetings. We have a couple of these folks here with us. I see Bobby, and a few other folks that are on the call with us here today. This is just our leadership team. Just gives you an idea of the folks that have joined the effort to be co-chairs. We are currently recruiting for a value and awareness co-chair that will meet later this month. And so if you're interested, you can reach out to me and we can get you connected to Pascal, the other co-chair, and we can meet and talk about what that looks like for you in terms of roles and responsibilities. But we just have a great group of stakeholders that come together to lead these meetings, help plan agendas, make sure that we're really voicing the member and the worker in these meetings. And so if you'd like to be involved, we'd love to have you. And just to kind of give you an idea of what folks have been working on, we actually do have Bobby here, as I was saying. We met, the Training and Career Advancement Action Group met on Friday. And Bobby, would you like to share just a little bit about what we're doing in that group?
Sure. Good morning, everybody. I'm glad you're here. Last Friday, we discussed about how that work group would like to do some badges for trainings so that if a personal attendant does a block of training like personal care, um, I don't know, personal care, uh, and then homemaker, and then other things that match with personal care, you would get a badge to say that you've done all this training. And it was similar to what we will be hearing about today, but that badge system will only be for the workforce career and workforce training website that we have been working on with I believe his name is John with HickPuff.
That's right, Bobby. Thank you so much. Yeah, I kind of threw you to the wolves there. But we did. We had a great conversation about how that group can continue to be involved in the Colorado Direct Care training and some badging opportunities as well. So again, we just encourage you to get involved if that's something that sounds good to you. Compensation and benefits will meet next Friday, September 19th at 10 a.m. We're going to take a look at reviewing the base wage compensation report that came out over the last couple months and planning for 2026. And then the Value and Awareness Action Group will be meeting Friday, September 26th at 1 p.m. And we'll be start our planning for Direct Care Worker Appreciation Week, which starts in April, which seems like it's a long ways away, and it is, but it will be here before we know it. And so if you're interested in getting signed up for the action groups, I'm going to drop the action group sign up in the chat, and you can get connected to any one of those or all of those if you're interested. I'm going to launch some polls now that it seems like we have a pretty good group of folks that are able to join us, and then we'll get started with our presentations. So the first poll is just going to be where you are located. And let me scroll all the way to the bottom here. And I know a lot of folks, if you're joining us from an agency, a lot of these agencies support statewide. And so if that's the case for you, just go ahead and place where you're living, where you're currently joining us from, and that should get us going. I'll give folks a few minutes. All right, and that has stabilized. So I'm going to go ahead and do that and share the results. So we have great representation from Region 1. That's pretty typical for these meetings. We know a lot of folks are joining us from that area. Good representation from Regions 2 and 3. I would like to say we are represented from Region 4. because I live in Montrose, and so if I could vote, I would have put in Montrose. We do have a few folks from Alamosa in those counties, Region 5, but we are still missing our Region 6 area, but that's that deep Southwest region. So we'll continue to do outreach to those regions, and we do have a few folks that join us from the action groups in those meetings, and so we'll try to get them to this meeting. But thanks for sharing that. And then let me do this one here. Give it just another 10 seconds or so, let everybody get a chance. All right, we'll go ahead and end the poll and share our results here. So we do have a few workers joining us today. Thank you, welcome, thanks for being here. A couple of folks who receive individual services, some employers, some advocates, government agencies, good representation from all of those, some trade orgs. And then if you did specify that other, let us know in the chat if you wouldn't mind where you come from. And then we can make sure that that's included on a future poll as well. All right. So I'm going to jump in just really quickly with a quick base wage overview for the direct care worker, and then I'm going to hand off to our other team that's here to share with you today, and we'll get kind of really into the content today. So just real quickly, since we are kind of in the end of this reporting period, we wanted to give you just a quick overview of the base wage. So the base wage requirement sets the minimum hourly pay that must be given to direct care workers who perform any of the base wage qualifying services in Colorado. And so we have a couple links here for you that I'll drop in so you can see what is considered qualifying services. But any agency that provides or delivers qualifying services is responsible for making sure all eligible workers, direct care workers they employ, are paid at least that base wage. This is kind of started 2022, 2021, I think, came out of ARPA a little bit. We've just kind of continued it since then. So if a direct care worker qualifies for a state or local minimum wage that is higher than the requirement, that agency must pay the higher wage. And so we think of Denver as a good example, having that higher minimum wage. And so therefore, based on direct care worker base wage or the minimum wage, we're going to be paying that higher wage. Provider agencies are required to demonstrate that all direct care workers receive the appropriate wage. And they do that by submitting detailed information for each worker, including rates, hours worked, benefits, work location, employment status and type, and the services provided through that reporting window, which actually just closed on August 31st. It's open 2 months out of the year, July 1st to August 31st. And we do have a couple of those resources that I'll drop in the chat once Jennifer starts talking if you want to get a little more information on that. But why are we talking about this? We really want to be clear today that there are technically 2 different teams within HCPF that you work with through this process. And so the long-term direct care workforce unit does that base wage reporting during those 2 months, and they make sure we're getting that information. They're working with providers in that time frame to get that information for that reporting piece of it initially. The financial compliance unit, who you're going to hear from shortly, will make sure that there is compliance with that base wage and it follows all federal and state regulations. And so it kind of takes that a little step further to make sure that we're complying with that base wage. And then we also have Carrie Chesney here, who's going to talk to us she's from the Department of Labor and Employment, and she's going to make sure that the workers have the resources they need if they feel as maybe they aren't being paid the base wage or they have other complaints. So those are kind of the 3 parts we're going to hear from, but just to be really clear that there are 2 teams at HCPF that you work with through this process, and each one kind of has a different role. And so I'll just kind of set the table for that. And at this point, I'd like to hand it over to Jennifer Watkins to talk us through her presentation. Jennifer, please.
Thank you, Brooke. Good morning, everyone. I'm Jennifer Watkins. I am a data and compliance analyst within the Office of Community Living, as Brooke lovely introduced me. And I do work on the team that conducts the compliance reviews to make sure providers are paying direct care workers correctly. So today, hopefully, I'll be able to answer any questions you may have as we walk through the wage compliance process. Good, you could go to the next slide. So just start off real quick. Here's an overview of the presentation today, so you can expect what we will be talking about. These sections will be found at the top of the slide, so you could reference where we may be in the presentation, but we'll start with some introduction and background to the reviews. We'll walk from the attestation to the review. We'll talk more with the review workflow itself, and then the review process and action we'll dig a little deeper in. We'll talk about corrective action plans, final steps and future outlook, and I think we'll definitely have time for questions throughout and at the end of the presentation. Perfect. So to kick us off, what is the purpose of a wage compliance review? So as you know, probably there have been multiple base wage minimum increases that have occurred in the past few years. So this review is intended to ensure that these increases did in fact occur for direct care workers. We have the regulations listed here. Brooke mentioned them earlier, but that's where you could find a definition of a direct care worker, which includes employees and independent contractors. But we reference this table that you see on this slide for hourly base wage minimum to really determine if the wages are compliant with the increases. So our goal is to really ensure that the providers maintain supporting documentation that demonstrates they are paying their direct care workers these minimum base wages at these appropriate points in time. And we also want to help providers fix these issues, as this is still a new process. So this is a quick reference that we use with the table, but that is pretty much the purpose of our wage compliance review. And go ahead to the next slide. Perfect. Who gets reviewed? All agencies. All agencies are expected to have periodic wage compliance reviews. So HCPF has been tasked to ensure wage compliance with all providers across the state who employ direct care workers. So what this means is when you receive the notification letter from us, it doesn't necessarily mean you are not in compliance, but it is our way to verify compliance. So initially with our reviews we are conducting now, we could go as far back as 2022. And as we progress further, it'll just come to where your last review ended. So as we kind of get going, please expect these reviews to go back as far back as 2022. Next slide, please. So then here, we are going to go through, this is our next section of moving from attestation form to the review itself. So this is where it might get a little confusing. But once the base wage team confirms attestation submission, the file is shared with the wage compliance team. And at that point, we assign the agency's file to a reviewer who then perform preliminary checks. This is to ensure the agency is within the scope of HCBS services. We do a claims data pull, really to ensure a review is necessary for that agency. But once those checks are passed, the reviewer prepares the notification letter to be sent to the agency. So I'll go through this really quickly again. As you see on the slide, it starts with the base wage team who accepts the attestation form. The base wage team confirms attestation submission, who then shares the attestations with the wage compliance team. Now with the wage compliance team, we assign the agency's file to a reviewer. We determine if a review is required, and we send out a notification letter. You can find this process at the Direct Care Workforce Base Wage website, and it goes into detail a little bit more on each of these steps, but this is a great resource if you want to dig deeper on any one of these steps. But just to clarify, that's the process of how it kind of hands off to the wage compliance team for review. And we go to the next slide. So next we will discuss the workflow itself for the review. The provider agency will receive a notification letter requesting a list of these initial documentations. So providers differ in payroll structures and systems. So front loading these documentation requests to streamline the rest of the process is really to avoid prolonged back and forth. We received feedback from those providers who have already gone through the process that they would rather have the full list up front to gauge appropriate time needed to be spent on pulling this information. And as we may request further clarifying questions and requests, the bulk of our requests are to be intended to be at the beginning. So let's run through these real quick. So the first one is a payroll roster for months X, Y, and Z in 2024, 2023, whichever year we might be asking for. This is to have a snapshot of the agency's list of employers. And this is to ensure we are capturing all those that should be included in the review. Now, versus in the past, we have requested selected direct care workers, usually from the attestation form. But now we've switched it up to just requesting a full payroll roster for specific months to make sure we cover everyone that may be entitled to any retro payment. So number 2, the second request is the direct care worker name and unique identifier. We hope this is the same unique identifier used on the attestation form, because this will assist us to connect the dots between payroll roster, pay stubs, attestation forms, etc. The third requested documentation is hire and termination dates. So these dates occur all the time. With this, we are then able to determine if a direct care worker is no longer employed with you, or if they were hired right before or right after an increase. We are able to determine where they might be entitled for retro payment if they are. And number 4 is wages, obviously, what you are paying them. Now, this is usually on the roster, so this could be in the same documentation, but we do need to know if they are being paid hourly or per diem over that specific time period we request. Number 5 is the service description and service levels. These are to answer questions like if a direct care worker is paid 2 different wages or multiple wages. There are agencies that do pay direct care workers differently depending on who they are servicing. But if the direct care worker provides multiple services, we would like to know that and which services they are. This really helps us understand your pay structure and reasoning. There's a large range of different structures, so this is very helpful. And then the last piece of documentation we request is the number of Medicaid members served. This helps us understand how many members each direct care worker is serving. There are agencies that may have claims that do not add up to this number, and we want to be able to pinpoint this discrepancy on. So that's a handful to take in. We're going to take a break. I'm going to go through just 2 more slides and pause for questions if people have questions specific to that. But with this, our goal is really to create a process where you as the agency can go into your payroll system, choose specific dates, and send these documents to the reviewer. And by anticipating these reviews coming up, each time we request documentation, it becomes as seamless as possible. So we understand everyone uses different software, and we want to help create a process for you to utilize your software to the fullest. So it's as easy as possible. And this may take some time up front to create, especially maybe the first review or 2, but the reviewers are here to assist. And I do want to mention, created reports are acceptable. So if you pull some information from multiple systems, different places, that's totally acceptable. We just will need to verify some information from that. And that could include pay stubs, time cards, per diem contracts, etc. But that is really our goal. Our goal is to really make this as seamless as possible. And then real quick, before we pause for questions, here I just wanted to share an example of a pay stub that if we request this as a follow-up documentation just to clarify things, this is a great example. You see the pay date on there, the pay period, and the taxes deductions. That's really for the employee to see what's being taken out. but you see the earnings there, you see the specific rate, the number of hours in the total. And here you could kind of list maybe then overtime, things like that. This would be perfectly clear for a reviewer to see maybe where a direct care worker is at with their wage. So with that, I don't know if anyone has questions now regarding the initial documentation, because that part is a meaty part of the review process. But if anyone wants to, we're good to move on.
And you're welcome
Okay.
to come off mute, raise your hand, whatever works best for you. Drop it in chat. And if you're chatting in, go ahead and drop it in, and I can stop Jennifer as she continues as well. And we'll make sure your questions get answered one way or the other. So I guess we're good to go, Jennifer.
Okay. If anything comes up, we'll definitely have time at the end. Okay. So continuing with the review process in action, at this point, the reviewer will take time to review the documentation submitted. And this can vary in time depending on how clear and readable the documentation is. Some agencies have more of a complicated system, so this may take some time to decipher if the agency is in compliance. So this time kind of varies at this point. But we do cross-reference the attestation forms from previous years. And if there's a concern or discrepancy the reviewer feels that needs to be clarified, they may ask for further documentation at this point with things like I just mentioned, pay stubs, time cards, contracts, etc. And that brings us, so next slide, please. Perfect. At this point, we determine if an agency is in compliance. If the documentation supplied supports compliance, there is no need for a corrective action plan, and the review will close. The agency will receive a final letter stating the review is done and the agency is in compliance. And on the other hand, go ahead.
Sorry, Jennifer. I just want to call out in the chat, just so it's captured on the recording. Ashley Weber asked if this goes for CDOS as well, and Kathy from your office answered CDOS is not included in these reviews. So just a good clarifying question there. And I'll hand it back to you. So sorry. Thanks.
No, that's great. There is, on that Direct Care Workforce Base Wage website is the list of qualifying services. So that's a great place you could check to see if a specific service is a part of this list. So great question though. So what this brings us to, if the agency is determined not in compliance by identifying wage discrepancies, a corrective action plan is needed. So if this is the case, a corrective action plan letter, also referred to as a CAP letter, is sent to the agency stating non-compliance. And this will come with a list of findings. So the letter will have specific direct care workers with the wages found at specific time points with explanations. So for example, you will see in the letter direct care worker number 8, or whatever their unique identifier might be, was paid $13 an hour according to the payroll roster supplied for July of 2024. So you'll have a list of exactly what we need to address in the corrective action plan, which is created next. And so if we're at this point and we send you the corrective action plan letter, we will supply you with the retroactive payment tool, and this will be attached to that email. And this is in the form of a spreadsheet, and that helps you determine the correct retro pay amount. It's pretty straightforward. You plug in the wage for the direct care worker during the respective time, and it will produce the wage difference. And then you plug in the number of hours worked during that time, and it'll determine the total amount for that retro payment. I've been on virtual calls to walk through this, so don't hesitate to ask your reviewer to maybe explain it further for you. But this could definitely save some time for you to determine the correct amount. I love that tool, so don't be shy. And the plan created should include each direct care worker that was listed on the CAP letter sent to you, explaining the amount due to the direct care worker, and then a date expected for completion. The agency then submits this plan to the reviewer, who will approve it, modify it, deny it. They'll work with you to find something acceptable for it. And it is recommended to share the corrective action plan with us before implementing retro payments. This is really to ensure you won't be overpaying back pay to the employee. We have had a couple instances where this has happened. So another set of eyes, it just doesn't hurt to make sure it's correct. But once the plan is approved, retro payments may begin. Installments are totally acceptable. So with that projected date of completion, for example, if you do 3 months of installment, that end date would include that. And so once the employee's retro payment is complete, once you issue those, we will request a pay stub, a copy of the pay stub for that retro payment. Some agencies have issued separate checks where it's just the retro payment amount. Other agencies have combined it with their usual pay check. If you do that, I would just recommend having another line item where it's clear what the retro payment was versus their regular amount, just to avoid the review having coming back to ask for clarification. So then that brings us to the closure of the review. So at this point, once the CAP or the corrective action plan is complete, retro payments are verified, a final letter is sent. So everyone receives a final letter, no matter if the CAP was necessary or not. But once you receive that final letter, we do recommend save this document for your records. So when we reach back out to you for the next review, you can familiarize yourself with what time period this review covered and what to maybe expect moving forward. Moving forward, this is still a new process, and we are collaborating with providers to make adjustments where appropriate to streamline the process. So feedback is always welcome. As your agency is reviewed and you have ideas on how to make this process easier, reach out to us and we'll look into it for future reviews. But please watch for memos and other communications related to direct care workers. A great place to stay is that Direct Care Workforce Base Wage website we've mentioned a few times. A lot of information there that you could reference as things are happening in real time. So keep that in your back pocket, and we truly want to be as transparent as possible with what we are requesting and why, so you can deliver compliance with ease. And that will bring us to some key contacts. Again, the wage compliance team, who is responsible for the reviews and questions for reviews in general, is that HCPF Wage Compliance, FCU, at stateco.co.us. You could also reach out to me personally, and I can make sure your question gets delivered to the correct team, or questions about this presentation, you can contact me at it's my name at state.co.us. And then again, the base wage team, this is with attestation forms or base wage requirement questions. You can reach out to HCPF base wage at state.co.us. So, and if anyone else has any questions, I don't know if I have seen anything in the chat, but I don't have it in front of me.
No questions yet, but we'll give folks just a few minutes.
Yeah. It's kind of a lot, so you could digest this and reach out at any point. I know this is being recorded, so once your review maybe comes up, you can pull this presentation back up and familiarize yourself maybe with the process.
Definitely. Any questions for Jennifer?
Hey, this is Joe from Leading Age Colorado. Just quickly wanted to ask, I'm not sure if I also do nursing home stuff, and they have like a pretty high rate with their pay for performance submissions, but I just wanted to see what was, in terms of how many providers are out there, what was the participation rate this year in terms of everybody getting their base wage attestations in on time by the August 31st deadline?
That is a great question. That will definitely be with the base wage team, since they accept the attestation form. So I'll have to reach out to them to see exactly where they might be at with that. But that is a great question to see out of everyone who's submitted it already. So I could take that back and reach back out to you, Joe, if that works for you.
That'd be fantastic. I
Yeah,
regularly try to alert our members, which include ACFs and adult day centers, just about that these upcoming deadlines, including this one. And I think it'd be helpful to see, besides HICPUF spreading the message on it, to see how other organizations such as our trade association um, con contributed to ensuring that there was compliance with this.
sure. Yeah. And just to know that that submission rate, that's definitely a separate number than the review compliance part of it. So we kind of keep that separate. So the number of agencies that submit their annual attestation form on time will probably be a different number than who might have fallen into compliance without needing a corrective action plan on the review side. But yeah, I'll reach out to the base wage team and see if I could get you a little bit more specifics on that.
Great. And I mean, just to know also, I'm not sure how much transparency there is around the data to know also about, what is the compliance versus the not in compliance and needing corrective action plans would also be nice to just have that data just to understand what you
Yes.
guys are working through so that we can be constructive
Sure.
contributors in this process.
Yeah, no, of course, that's a great number to see as well. And of course, being like the first few reviews, it'll probably be the big education part, a learning process for the first time, and hopefully then we'll get that compliance rate up. But I could get that number to you as well.
Thank you.
Yeah, of course.
And I will just note too, Joe, I know you've been in a couple of our action group meetings as well, but we can talk a little bit about that in our upcoming compensation and benefits action group meeting. So perhaps, Jennifer, we can loop back with you and the base wage team as well. I know we're going to be going over the base wage report, and so that just might be a good opportunity to kind of talk through those numbers as well. So Joe, I'm going to shoot you a DM and get your email address so Jennifer can follow up, and we'll look forward to talking about that more.
Thank you.
Any other questions? Get back to the chat here. Someone did ask if we just shared the HICPUF page that shows the qualifying services. It's just that HICPUF base wage page. I went ahead and dropped the link in there. It's just on that main page. As you navigate to that site, there's a whole list of them there pretty much right at the top. And then you'll also see that there's links to the different memos and reporting and compliance and all sorts of good stuff there. So.
Well, I'll hang out for a little bit in case anything comes up toward the end, but you guys have my email. Oh, I think I see one coming in.
Yeah, I can read it out, Jennifer. It's how do you determine minimum wage for per diem providers, specifically host home providers?
Great question. So I didn't specifically share the increases that we reference for per diem, but there is the across the board rates. So if we go back to 2022, there's a different percent increase for each one, for each year. So we'll check with that if that increase has occurred from the past year to the next year. But then targeted rates are going to be completely different as well. I could share the rate schedule in the chat for you, so you could specifically see specific services of what you're looking for. And so for host home, you can look up host home specific, and if it lies between that. So then when we perform a per diem review, we'll request multiple years to confirm that increase did occur. So a little different and a little bit more specific. Didn't really want to overwhelm everyone with the per diem rates because it is a little bit more specific, a little bit more tricky to determine. But we do ask that initially in our documentation, right? If it is a per diem wage. So I'll drop that in the chat for you to reference. And if you want to chat about that a little bit more, don't hesitate to reach out. We could dig a little deeper specific to your qualifying services, perhaps.
And I just threw the key contacts back on the screen there too, if you want to reach out. But yeah, I think sharing the rate schedule would be helpful, and I'm sure we'll make sure we capture that in the recording and the notes as well.
Hopefully that
Okay.
answered your question currently for the time being. Awesome.
Any other questions? All right. Well, it sounds like, Jennifer, you're going to hang out for a bit. So if you have anything, just maybe Jennifer and then the question in the chat, and she can be here for a little bit to answer those for you. And if not, feel free to reach out afterwards. But thank you so much for being here, Jennifer. This was great.
Yeah, thank you for having me. Good to see everyone. Thank you.
Thanks so much. All right, we're a little bit ahead of schedule, but that's okay. That gives us more time for chit chat and questions down the road. I'm going to hand it over to Carrie, who's going to introduce herself and talk a little bit more about resources for workers. So Carrie, I'm going to stop my share and you are all set to go.
All right, hold on just a second. Let me get the right tab shared here. Okay. All right, wonderful. All right. Hello, everyone. My name is Carrie Chesney. I work for CDLE, specifically the Division of Labor Standards and Statistics. And today I'm going to talk a little bit sort of about when workers might consider filing a claim with HCPUF or reporting to HCPUF versus filing a claim with our division. I know Brooke said, we provide resources for workers, but actually we provide resources for everyone, and that includes employers. We do actually also do outreach to employers as well. What we can't do is provide like legal advice, but we do have a ton of different resources on our website, and I will talk about that in a minute. Note that this presentation that I have today is actually a portion of our direct care workers know your rights training. So, and this is actually a fairly targeted portion of it. I'm going to kind of go a little bit maybe more in depth than I would in the general presentation. And the general presentation has more information about, labor law and like what your rights are under labor law. So just to know that that is the distinction. This is me. I'm the one of the outreach managers for the Division of Labor Standards and Statistics. The other is Eric Yohe. He couldn't be here today, but you can always contact me. You can contact him if you want some outreach to your workplace, to your workers. We are happy to do that. So the Division of Labor Standards and Statistics, what do we do? So myself and Eric are actually from the labor standards side of labor standards and statistics. The statistics does work statistics. But our division enforces certain types of labor laws. So what we talk about is, what are labor laws? What do they do? Labor laws inherently, protect the rights of workers. And there are many different kinds of labor laws. I am not going to go into them today, but the ones that our division enforces are specific generally to payment of wages owed to workers. So those are things like unpaid wages. So straight up wage theft. My employer didn't pay me today, right? They didn't pay me for the work that I did. Minimum wage violations. Overtime pay. So if a worker is not getting overtime pay, if they're not getting their break times, if they're impermissible deductions, that's when an employer, deducts money from wages, that were already worked and that are owed to that worker. And they do it when they're not supposed to, right? Paid sick leave. We have a paid sick leave law in Colorado. Employers are supposed to be providing a certain amount of paid sick leave to workers. And others. So note that our laws primarily apply to employees, so non-exempt employees, right? There are specific exemptions outlined in the law. I'm not going to go into that today. We do not cover independent contractors. Independent contractors can sometimes be misclassified, and then we might do an investigation involving, whether or not that worker is misclassified, they should be an employee, but actually, they're classified currently as an independent contractor. But generally, what we're talking about today, these protections, overtime, break times, they apply to employees, right? Now, if you get nothing else from my presentation today, coloradolaborlaw.gov. That is where you will find all of the information regarding Colorado labor law. We have infos pages, we have a ton of different resources. We have short form videos to educate people on specific topics. We're sort of still filling that labor law library out. But we do have a ton of resources there. We actually have a webpage specific for the direct care industry, partially because we also run the Direct Care Workforce Stabilization Board. And so we have like an actual specific webpage for direct care. We take email, we take questions, call center. Again, we are not attorneys and we cannot provide you with legal counsel, but we can provide you with some direction. Okay, the direct care worker base wage rate. So I'm not going to go over this much in detail, right? Because Healthcare Policy and Financing already spoke to it. But it's sort of like, when is a worker going to contact them versus when they're going to contact us, right? I want you to look at the bottom, sentence there. Base wage violations can be reported to HCPF. So if we're talking about something else that our division would handle, overtime pay, travel time pay, break times, Healthcare Policy and Financing doesn't have a mechanism to enforce anything there, right? So they may want to know it. I don't know. I don't know if you guys want to know something like that about employers who are not providing break times, that kind of thing. They might want to know that, but they don't have a mechanism for enforcing it, right? They do have a mechanism for enforcing and at least assisting employers with some of these base wage violations, right? And so, if you're just not getting paid your base wage, you might want to, report that to Healthcare Policy and Financing, because they're going to work with that employer to try and get you paid, right, as a worker. Now, our division, so when a worker files a claim with our division, one, it can be any worker from across the state in any industry, right? We take claims from all over, right? But our process is a legal process. It's a legal administrative process that you would take in lieu of going to small claims court, right? So what that means is that we can actually get recompense for wages owed, right? We can levy penalties and fines, but it is a legal process, right? And so it takes time. And, from our data, like, we know that workers primarily come to us after they've already separated from employment. And that makes sense, right? Because if you file a legal claim against your employer, a lot of people are worried about what's going to happen. Now, it is illegal for an employer to retaliate. There's actually retaliation law, an anti-retaliation law, for filing that claim. But workers are going to kind of do that math in their head, right? Like, can I afford to not have a job just to file this claim? Maybe not. And maybe, if their primary issue is the direct care base wage, maybe they're going to go to Healthcare Policy and Finance, right? Or they're going to wait until they leave that job to file regarding issues. Now, they may report to us. We do have a tip and lead form, but we can't really take formal action unless we have a claim. We do have a team that does employer-wide investigations. Currently, they primarily do a lot of agricultural investigations and construction investigations, but they can do anything. They can do any industry. So, we do targeted investigations through that team. Okay, so, this is sort of what happens when a worker submits a claim to our division. So, and this is the very short form version of this. So so this is sort of what we generally tell people, which is, if you're a worker and you think your employer owes you wages, you can do several different things. You don't have just one lane you can take. You can go to small claims court. You can file that yourself if you're trying to file for under $7,500. Or if you'd prefer to come through us, through the Division of Labor Standards and Statistics, and go through the claim process, you still have to file under $7,500. we can only go up to that amount. Although, like, if you have a larger amount than that, if you just want to claim 7,500, you can still come through our division. If there's, I didn't get paid my overtime or whatever it is. Note that the process takes a while because it's a legal process, but it's an investigator who adjudicates it. It can be appealed, just like any legal finding, right? So it is, kind of works concurrently, it's an option you can take instead of going to small claims court, basically. Now, if you're owed more than that amount, you might want to consider speaking with an employment attorney, right? Because at that point, you're going to have to go through the full legal system. Or if you just want legal advice, you can go to an employment attorney, right? And that's true for workers, that's true for employers, right? Now, so to file a claim specific to our division can't take claims that are over 7,500 currently, and we can't take claims that are over 2 to 3 years old. And when I say 2 to 3 years, our statute of limitations goes back 2 years, right? If an investigator finds during the course of an investigation that the employer acted in a way that is known as willful, which is they should have known the law or they did know the law and they still didn't follow it, if there are additional wages back 3 years, they can go back a third year. So generally speaking, most workers can only, file for 2 years, but if there happened to be a third year and it happens to meet that willful criteria, then that we can adjudicate for that as well. Note that, we take claims as we get them and you go into a line, basically. So it takes some time for your claim to be assigned to an investigator. Like, we're not going to be able to get your money back immediately. That's probably not going to happen. Just because it takes time for that process to happen. The investigators, take your claim, they go to the employer, there's a lot of back and forth, right? DLSS investigations have what is known as a shifting burden of proof, meaning that when an investigation is initiated, it is the responsibility of the employer to prove that it has complied with Colorado law. So ultimately, the burden of proof lies on the employer side, right? In part because, the employers have the documents, right? They have the documents to prove or prove what they're saying, right? And, we tell workers, like, if you just had a verbal agreement, like, this is what I'm supposed to get paid, this is, when I'm supposed to get paid, we can still adjudicate that as long as you can do what is known as stating your claim. So I didn't get, any of my wages from X to Y, right? From this date to this date. If you can state your claim and say we had a verbal agreement, we can still try and adjudicate that. We will take any evidence that a worker has. Like, if you're a worker and you have emails, you have your pay statements, you have your time cards, any of that kind of stuff, we'll take it, right? Obviously we'll take it, but it's up to the employer to show that they followed the law. So for our general website, if you go to coloradolaborlaw.gov, you're going to click on a big exclamation point icon at the bottom of the page called File a Complaint. And you're going to click on the down arrow that says Worker Forms. And you are going to find, you can either submit online. If that is too complicated, sometimes people find it confusing. You can also print out a form and then mail it to us as well. And we will take that. Are there any questions?
Thank you, Carrie. I have kind of been dropping links in the chat for folks just to explore.
Awesome.
Looks like Jennifer is answering questions related to her presentation still. Anything for Carrie specifically? And I will still get a copy of Carrie's slides and include them in the slide deck as well with the active links and things like that. So we should be good.
Great. Awesome. Thank you so much.
Thanks, Carrie.
Yep. Bye-bye.
All right. Well, I will get us back into our agenda here. Let me just get this shared. Things seem to be running a little slow today, but that's all right. So we're going to launch into, this is a pre-record that we had. Dr. Kelly Page wasn't able to be with us today, but we are going to go ahead and launch into this. She's going to talk for about 10, 11 minutes on the pre-record, and we'll have time to answer questions for you afterwards. Just kind of to level set a little bit, we have been working with it was an opportunity through the Colorado Workforce Development Council, and they had applied for a grant that they're calling Colorado Forward, where we're working with a team to see what a digital wallet with badges would work like for Colorado Direct Care training. So through the DCC, through Direct Care Careers, if workers go in and they take these courses, the CDCT courses, and got a badge for the completion of that training, how that badge would then operate in a digital wallet, so that that worker could, if they changed positions, if they were applying for a new job, if they just wanted to show their competency, they could use that digital wallet to go to an employer and say, hey, I've taken these courses. And so we're piloting that right now. And so this is an opportunity for learners and earners to take part of that opportunity to help us test that on the back end to see how it actually works in practice. I am going through all of my slides, so let me get back to the agenda and pull up the recording of Dr. Kelly. And then we'll play this. Feel free to drop questions in the chat throughout the presentation, and I'll make sure we go back through them at the end. But she gives a little bit of information and then the process, and we'll have some links to share. So let me get this pulled up here. And
hi, so my name is Dr. Kelly Page, and I am sharing with you today about a project we're doing here in Colorado called the Colorado Forward Project. It's in partnership with the Direct Care Workforce and Training team that runs the Direct Care Careers Online. And I want to tell you a little bit about the project and invite you if you wish to get involved. So firstly, what is Colorado Forward? So this is a 22-month demonstration project. And the mission of the Colorado Forward Project is to power a future where learners and workers, so direct care workers such as yourselves, have more control over their skills information, their learning information, and their work information, and use that information to share a story about their skills, about where you got your skills from in a very robust format. And that data and information can be used to match you to opportunities, be used towards advancement or promotional opportunities, and really just show the world what you can do. Partners that are involved in the project. And the whole point of the project is to test a digital skills wallet, learning and employment credentials that might have been issued to you in a wallet, and see how valuable it is to you. We've been working with workforce centers across the state, as well as the Colorado Hospital Association, Colorado Succeeds, the Department of Healthcare Policy and Financing is why I'm here today. And so really it's a project to really see how might technology help us make skills and experiences more visible and more recognized. So throughout our learning and work life, we are collectors. We're collectors of experiences, we're collectors of skills, we're collectors of all sorts of different knowledge and information to help us do our jobs better, but also to thrive and in our lives. And so throughout your learning and work opportunities, you have certain needs where you might have to develop certain skills to get credentialed, to get licensed, to work in a certain role. This could give you opportunities in work and at work, not just in training and education, you're learning skills on the job. And this also helps employers know where to match you, where to put you for a role, going for advancement, and really improving their hiring abilities and so forth. So what we see is skills and competencies are the core thread across learning and education opportunities, and as well as work development opportunities. And so skills really matter in this conversation. And we're really working on how can we actually unlock skills so that they're portable. So for example, our skills exist in our hearts, our bodies, and our minds. And the only way they benefit us for opportunities is if we can make them visible to other people and if we can share them. And so in this project, we're testing a new technology to make skills information, experience information more visible, not just from a resume, but from actual credentials being issued to you. So what does that mean in terms of recognizing direct care workers for your skills and your experiences? So over the last couple of months, we've been working with the team who've been leading the efforts for the Direct Care Careers online training portal through HCPF. And we've really been looking at all the different training opportunities through this portal to see where are there ways and means that skills are being recognized, experiences are being recognized, whether it be you're taking a training, doing an assessment, and then you're being issued with a certificate of completion or some kind of validation of the skills that you learnt or that you're showing by doing these courses. By validating and recognizing individuals for their skills is really, really important. And it can happen in a number of ways. Firstly, by recognizing and validating skills, it shows what's valuable, what matters. It also shows where people might have learned these skills. You can be recognized with certificates, with references, with promotions and pay rises. Here in this work, we're really working with the Direct Care Careers online portal to see once you've finished training and you're issued with a certificate, how can we ensure the skills and competency information from that training is in your credential so you get it in your hands to use how you wish. And so that's what we're testing. We're testing a new technology. They're called verifiable credentials. Now, whenever you do complete anything, such as training program or something at work, sometimes you'll be issued with badges, a certificate, a reference, and that information can come in a variety of digital or data formats. You might have got it as a PDF and it's a certificate you can print up and put in a frame. You might have got it physically. You also might have been emailed of some verbal praise by a manager. Now, these ways of recognizing people are many and very different digital and data formats. What's hard is they're not necessarily portable. It's really hard to share them, it's really hard to store them, they can be easily lost, and also they're not necessarily verifiable. So it's really hard for an employer if they need to verify your nursing license or they need to verify you did CPR training. It can be hard for them to validate the information that you've got. We're testing a new credential type or a data format called verifiable credentials. And when you issue anything, certificates, references, even a job contract in a verifiable credential data format, it makes it easier for you as a learner and worker to have access to the information and to share it with others in a secure way, protecting your privacy, but at the same time enabling someone to verify it if they so need to for compliance or for a promotion or whatever that looks like. So in this project, here's an example of the system flow. Imagine you have a digital wallet, and you might already use the My Colorado wallet for your driver's license, your vaccination record. That's an example of a verifiable credential. Teacher licensing and credentialing is now in the My Colorado. We're looking at what does it look like to have the credentials and the skills and experiences of direct care workers also accessible in a wallet format. So you'd have a wallet, you get issued with a credential, say from HCPF and the Direct Care Careers portal. You will download it to your wallet and you can store it and then share it with employers or share it to LinkedIn or a talent marketplace to help match you to jobs. So this is the nature of the technology we're testing in this demonstration project. We've partnered with a technology company called Spruce ID. They have shared with us a platform so that we can issue these verifiable credentials. You as a holder can claim them, and then an employer could verify them, or even another person can verify them. And that's what we're testing in this demonstration. So HCPF, or the Direct Care Careers team, they'll be issuing verifiable credentials through the issuer dashboard. If you've taken any training that's on the portal, you can sign up and register to be a part of the project, and you'll receive your certificate as a verifiable credential through the issuer dashboard. You'll have a wallet called the Forward Wallet on your phone. You will receive an email. You can claim your credential and add it to your wallet. What's unique about these credentials is the amount of information and data that's in the credential that you now have access to, that you can use and you can share. If anything happens to the Direct Care Careers online portal, you'll still have the credential. This is something that's really important. Also, if you decide to share your credential with anyone from your wallet, you'll get notified if anyone accesses it or needs to verify your details. So it's privacy preserving. So if you'd like to participate in this demonstration, what we're doing is we are recruiting individuals who have completed any of the training on the Direct Care Careers portal website. You can register by scanning the QR code on the screen. I've also asked Brooke and the team to share the link with you. You'll also receive an email inviting you. And it's really simple. There's 3 simple steps, and we have compensation to thank you for your time testing this solution. So the first thing you'll do is you'll receive a welcome email from myself, Dr. Kelly Page, welcoming you to the project with a link to the first task or engagement. And that is a survey just to tell us a little bit about you, how long you've been working in direct care, and also what is your experience of being recognized for your skills been actually like. Shouldn't take longer than 15 or 20 minutes. You'll then get another email inviting you to watch a video about the technology and how it works. And you'll be asked to provide a bit of feedback on the technology just from the video. If you're then comfortable to receive a digital credential, you'll receive a survey to register, and then we'll issue you with a credential for whatever training programs you've completed to the Direct Care Careers website. You'll need to have completed some training to receive the credential. That'll be validated by our teams. So the entire of your participation in this engagement is no more than probably about, I would say, maximum an hour, up to maybe 2 hours. And we are compensating people $25 per engagement or $75 in total. And you'll receive this after the completion of the last engagement as a $75 digital gift card. You can claim it as a Visa gift card. You can transfer the money into your PayPal, Venmo, your bank account. And it's just a way for us to say thank you. If you have any questions about the demonstration, the project, you can contact me at kelly@livewhatyouLove.org. And we are really putting this in front of people across Colorado, from job seekers to direct care workers, behavioral health specialists, to really get an idea of whether the healthcare workforce, this would really be of value to you to be able to claim your credentials, have them in your wallet, on your phone, and be able to share them with other people. And we're interested in whatever your feedback is. Is this something that's of value or not of value? So I'm going to hand back over to the team at HCPF, who's going to share a little bit more about it. But that is the Colorado Forward project, and we're inviting you, direct care workers, to join us and share your feedback and thoughts on the Colorado Forward solution. Thank you so much.
All right, perfect. So let me come back to you all here just to chat through a little bit more information about that opportunity from Dr. Kelly. And so we are just one of several different demonstration sites. As she said, there's folks trying this in the community college system. There's folks trying this in the behavioral health system. And we just decided that it would be a great opportunity to try it with the Colorado Direct Care training. And so this is an opportunity for folks, typically direct care workers or paid or unpaid family caregivers that can go ahead and use this training or have taken these courses already. And so if you're already in the DCC and you've already taken a couple of these modules, you're eligible to apply. But we do have a little bit of time here. So if you haven't taken modules in the DCC yet, but you are interested in participating, you can sign up and take a couple modules and then reach out to Dr. Kelly. We really would like folks to kind of get this, your interest and the courses and stuff in the next couple of weeks, because we are just running this through the end of the month. It's a grant. And so the money kind of peters out there in October. And so we want to make sure we get folks enough time to go ahead and do this and get some feedback. And so if you are in the DCC already and you've taken modules from Colorado Direct Care Training, or if you have time to do that in the next couple of days, we would say that you are eligible to do that. Ashley had a great question in the chat of how many years before certs will need to be renewed, or are these for a lifetime? And so a little bit of both, Ashley. We're kind of working, and this is actually something we're hoping we can get from folks during this trial, this feedback opportunity. We're thinking on the badges and in the credential itself, we will say when it was issued or when you took the course. And then that way it's up to the verifier or the employer to say, you know what, I'd like if you took this every year, so we're go ahead and have you do it again. Or you took this 2 years ago, I think that's good. And so instead of it expiring at some point, we're thinking we're going to put the date it was issued, and then the verifier can determine how that works best for them, if that makes sense. And so, yeah, it's a great opportunity. Dr. Kelly's really great about checking in with you. There's, again, 3 different engagements. And so if at any point during those 3 engagements you feel like it's just not for you, you're welcome to pull out. But yeah, she's open to feedback. She's really accommodating. And we're just really excited. This has been a lot of great information around just like looking at the competencies of the Colorado Direct Care training modules. We've done a lot of mapping. It really just allowed us to kind of dig in and see how it's going to work best for folks. So yeah, that's the opportunity. If you have any questions, I would encourage you to reach out to Dr. Kelly. I can drop her, actually John on my team. John, can you drop Dr. Kelly Page's email address in the chat for us? I didn't have that on the document, but reach out to her first. And if you're not able to get your question answered, then go ahead and reach out to our team and we can kind of help facilitate that. But yeah, feel free to fill out that form and engage in it. We're excited and we'll certainly bring back the results, you know, at the next collaborative or in training and career advancement action group, just so you can kind of keep a pulse on kind of how this kind of played out. I'm going to get our slides shared back up here. And kind of take us out into our closing a little bit. I see that there's some little black boxes on the screen. I apologize for that. Hopefully those will kind of fall off. Or at least it's not covering really important information. But at this point, as we kind of get ready to close out, I do just want to take a second and ask before you log off, if you wouldn't mind just opening and taking our feedback survey. It's how we kind of determine how we're doing in this meeting. And we can also kind of take information that you provide in this feedback survey to implement in future meetings. In fact, we're going to go into one of those portions that was suggested on a feedback survey right now in terms of our open forum and announcements. This is where we just like to take a little bit of time and allow folks who are attending the meeting to share any resources, to ask questions, to drop links, and just kind of do a little networking and operating in this space as a group. So I'm going to quit talking for a little bit and let folks come off mute, drop it in the chat, and share. And if nobody has anything, we certainly always have things to share. So. I tell you what, I'm not sure where all these black boxes are coming from. I'm pretty sure it's my toolbar, but this has never happened before. So I apologize that there's just a box on the screen. One thing that Carrie alluded to in her presentation is the Direct Care Workforce Stabilization Board. And I will say that they are having a meeting this Friday at noon. So let me see if I can get you the meeting information for that and drop it in the chat. They are working through their Direct Care Workforce Stabilization Board recommendations. And so there's a link to the recommendations as they were drafted. And then there's also some information and agendas, I think, that Carrie's also provided on there for us. So I will get that website in the chat for you. And if you scroll down underneath the calendar on that website, you'll see the information to join Friday's meeting. And it goes from 12 to 2 through Zoom. There's a virtual option, but there's also an in-person option too as well. Any other thoughts, questions? Another thing that I will share is just understanding and making time and space that this is a really challenging time. There's just a lot of changes happening both at our state and at our federal levels. And so there are a couple websites that HCPF has put together just to kind of keep you up to date on the most accurate information from the department. And so the first one is understanding the impact of federal changes to Medicaid. That's a whole HCPF department website. And so you'll see announcements from our director, Kim Bimsteffer, on there, also updates and links, all from our communications team. And then the second one I've added is the Medicaid Sustainability in Colorado's LTSS system. That's a little closer to home. That's a little more Office of Community Living and Long-Term Supports and Services. That'll give you a little bit more information on that. Again, just a couple websites to bookmark and keep track of. Just kind of things are continually changing and information's kind of coming at us very quickly. That'll kind of be a source of truth for some of these things, and hopefully we'll just continually update those for folks as things change.
Brooke, I will also mention, going back to Dr. Kelly and the LURS, if you are already signed up for the Direct Care Careers website, I'm going to be sending out an email through the website. So if you're signed up, you should be receiving that that email this afternoon with all of the information for Dr. Kelly's pilot on the LURS.
Perfect. Thank you, John. Lots of opportunities to message us out. We're excited for folks to hopefully get a chance to participate and provide a little feedback on that. If there is nothing else, we do want to announce that we just recently launched the 2025 Direct Care Worker Satisfaction Survey. If you've been around us for a while, you know this will probably be the fourth rendition of this satisfaction survey. We brought it in-house this time, and so it's a little different survey platform than maybe you've seen before, but we are doing that through Alchemer. So we have a new link to the new survey, and then we also have a report that has come out about the previous years, what we found out in those previous years in the satisfaction survey. So I'll drop those in the chat. And again, they will be provided. These are active links, so when we post the recording and the slides, you'll be able to find those. But it's been open. I think I sent out the big mailing. We announced it in Friday's Training and Career Advancement Action Group. They were kind of the first to know, and then we did a big mailing on Monday and Tuesday. And I think we're up to just over 80 completed so far, which for a couple days, that's not bad. We're feeling good about that. And we still have a lot of opportunities to message this. It'll go out in the OCL newsletter. I believe John is going to put something out on Direct Care Careers. And so this is just a link that you can share with any workers in your life. Paid and non-paid family caregivers are included, direct care workers, CNAs, all those folks that are kind of working in this space are welcome to take that to let us know how things are going. We're going to leave it open throughout the month. There's really no end date where we're going to turn it off quite yet. We just want to see kind of how responses come in. We'll message that out to you, though, through this listserv and also through the action groups. But I anticipate it will be open at least through the first week of October, if not a little bit longer. And so feel free to push it out through the month. Again, I apologize with the black box, but that I think actually maybe if oh look, all right. So that was my Zoom toolbar. So we do have a topic request form. So if you do have topics that you are interested in having us bring to you in future collaborative meetings or even the action groups, you are welcome to use this topic request form. I'm going to drop again the link in the chat. We love our links in the chat. But I promise we'll round those up at the end and make sure you have access to all of those after the meeting. So you're not trying to write them all down, but so that's topic request form. What that does is that'll come to me and I will share it with the leadership team, with the co-chairs of our action groups. And we'll kind of vet it, make sure that it fits this space or if it better fits an action group. One way or the other, you'll hear back from us about if we're able to schedule that, if you have any ideas on who could present for that. If you're a presenter and you're interested in bringing your information to this meeting, you could also use that form. And so just a way for you to have a say in kind of what is coming up at future collaboratives. Speaking of future collaboratives, our next meeting will be Wednesday, December 10th. Same time, 10 to 11:30, same Zoom link. And information about that and other meetings can be found on our website, or you're welcome to email us at any point as well. And I think most of you probably have our email already, but if not, we will put that in the chat for you. And again, these are live links that'll come out in the slides. So save the date for us. Also a reminder for Compensation and Benefits Action Group meeting next Friday, the 19th, and then Value and Awareness Action Group meeting the following Friday on the 26th. And then just my final call to take that feedback survey for us. Let us know how we're doing. Let us know how we can make this worth your while. Share this opportunity with folks. Invite a friend next time. Invite a worker. We'd love to have anyone else join us and just share out this information. So thank you so much for being here. We appreciate it, and happy to get you out of here just a little bit early. Thanks for being here. If you need anything, please just let us know. Have a great week. Thank you.